Good evening, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for another live, interesting Facebook discussion that we're going to be having tonight. Did you know that a stroke is 80% preventable? That's an interesting statistic. Of course, May beginning just a few days ago. This is Stroke Awareness Month. We're joined by Dr. Amre Nouh. He is the director of the Comprehensive Stroke Center here at Hartford Hospital. Dr. Nouh, thanks for spending some time with us.
Oh, thanks for having me.
That's a startling statistic, I find. 80% preventable. We think that obviously genetics does play a role, but not as big of a role as we might think.
That is exactly correct. I mean, stroke is the leading cause of preventable disability worldwide. When you look at the data and you look at the risk factors for stroke, they are the traditional risk factors that are commonly shared with heart disease. Most of them are. And controlling those risk factors can prevent a stroke from happening about 80% of the time. So if we were to focus on some of those risk factors, I would say that the most important risk factor, number 1 and 2 and 3 cause of stroke, both types, hemorrhages and ischemia, where there's lack of blood going to the brain, is high blood pressure. I mean, hypertension is the silent killer for a reason. I mean, it's really causes a lot of changes. The blood vessels of the brain can make the blood vessels, more prone to bleeding or clogging off. So that is a major risk factor. Other risk factors that are also important to note are high cholesterol, diabetes, sedentary lifestyle, being overweight, for example, smoking, alcohol, drugs, sleep apnea. These have all been shown to increase risk of stroke.
So an important takeaway here is really know your numbers, know your cholesterol numbers, know your blood pressure, get frequent checks of blood pressure. Maybe it's not a bad idea to have a blood pressure unit at home. I know I do, and check it just so you are aware of your numbers and where you kind of fit in.
Precisely. I mean, having your routine physical is important, but I think also noticing the subtleties. Be sure to talk to your primary care provider about these things, especially if heart disease or stroke runs in the family. Now, you mentioned genetics, and in some families, indeed, there's a strong family history, but the genetics being the primary cause of the stroke, is the minority of the case. The majority is there's common risk factors in the family, and stroke is a complication of those things.
Yeah. And when we talk about stroke and sort of the signs and the symptoms, you may have heard the acronym FAST, and that's a good way to remember that. Talk to us about what that means.
So FAST is the most commonly used way to remind us and recognize stroke, and we had mentioned that F is for face, so asymmetry of the smile or drooping on one side of the face. A is for arm weakness, so if an arm is drifting down, if you try to lift them up, or is weak. S being for speech, and it could be slurring of the words, garbled speech, or somebody knows the words they want to say but they can't produce the words, or it's garbled. And T is for time. Now, typically, these are not necessarily, it's not all the strokes present like that, but it is a sort of a lot of strokes present like that, so it's an easy way to remember. But other things to mention, which should be alarming and should prompt medical attention immediately, would include sudden loss of vision. And when I say that, it could be painless loss of vision in one eye, or loss of vision on one side of the visual field, so everything on this side you can't see or that side you can't see. Sudden numbness on one side of the body that splits down the middle, or weakness on one side of the body. Seeing double all of a sudden, you're seeing two images. These are things that can occur and also need to be addressed.
And you mentioned T is for time. Time, of course, is brain.
Yes.
How much time are we talking about by the time these onset of symptoms happens to when I need to get to the hospital? Is it 3 hours? What's that time frame?
Well, it is absolutely the sooner the better. I mean, every minute of stroke, about 1.9 million brain cells die, and the death is usually irreversible. So the sooner you come to the hospital, the sooner any interventions could be done, the better, to try to reverse the process. So the 3 hours, for example, is we can use a clot-busting drug like TPA within the first 3 hours, and in some patients a little beyond the 3 hours, maybe 4.5 hours, but not everybody. And then other treatments include clot retrieval, and we're a comprehensive stroke center, so we have that on call 24/7. In some patients who have a big clot that's in the blood vessels, within 6 hours typically is the most favorable time window for that.
Yeah, and those are pretty major, a stroke event when you have to go in and stent, or if you have to give the clot busting medication. I think
Yes.
what's important to mention here is that here at Hartford Hospital, it's 24/7 neurosurgical care that is provided. There is a team on call 24/7. What could be a major event and reverse that.
Yes, and I'm glad you mentioned emphasizing the team. I mean, the stroke team is primarily the neurology service. Neurosurgery is there. We have emergency physicians who are trained to take care of stroke patients 24/7, dedicated neuro-ICU, neuroradiology. So all the subspecialties are there and are on the same page and all communicating, which is, I think, the most important thing for patient throughput and to really take the best care of our patients as we can if they're experiencing a catastrophic event like a stroke. So.
Yeah, absolutely. Yeah. So what happens when someone comes in? The team is alerted, they're mobilized. What happens when a stroke patient comes in?
Correct. So typically a patient coming in either from the field by EMS, for example, they would notify the hospital coming in that we have a patient that, and believe it or not, the EMS use FAST to identify stroke signs and symptoms, and sometimes they let us know in advance. Once the patient comes in through triage, they are identified as a potential stroke patient. Immediate alert goes out to our teams. So emergency medicine is there, neurology is there, and nursing is there. Patients get a scan immediately to identify if this is a bleed or if this is not a bleed, and then based on that, they're evaluated to see if they fit the criteria to safely take, to safely get the TPA, for example, or get a procedure. Because even though some people may not be eligible for those treatments based on their profiles of risk factors, the time window, and some other constraints.
And that's where that comprehensive team really comes into play, because you're really analyzing this patient. Every patient that comes in, of course, is different. Yeah. And I think that's where the experience is vital. You all get together collectively and figure out what's the best course of treatment for this patient.
Absolutely.
We're talking with Dr. Amre Nouh. He, of course, is the director of the Comprehensive Stroke Center here at Hartford Hospital. We invite you to ask him a question while we have him here for a few minutes, general type questions about stroke. I want to talk now about TIA. So this is a different type of stroke, or sometimes referred to as a mini stroke. Or tell us how the difference between that, because sometimes the symptoms could be the same. So.
Precisely.
How do you differentiate if you were seeing a loved one who may have these symptoms?
Well, Tina, I'm glad you brought that up, because the TIA stands for transient ischemic attack, and that is basically a stroke that was about to happen and did not. And the same signs and symptoms of a stroke are those that a TIA, somebody experiencing a TIA might have. And a typical or classic TIA only lasts a few minutes, actually. So if somebody, for an example, a family member or a patient all of a sudden, becomes confused, the speech is slurred, there's drooping of the face and the arm, and everybody's recognizing there's something wrong, but it lasts only 10 or 15 minutes and it's gone and it's completely resolved. Right. A lot of folks might be alarmed by that, but some other folks may say, oh, well, that's over, I'm fine. Mm-hmm. But that is a warning sign that something is not right. There's something, in the patient's health that is putting that risk of having a stroke. And a TIA is usually a heralding manifestation of actually having a stroke, and the risk is very high in the first 2 weeks after a TIA. Usually the first few hours or 48 hours, within 24 hours, the patient should be evaluated. So if somebody does experience a TIA, I urge them to not
ignore that.
Right, yeah. Right, or minimize it. Yeah. Definitely get attention, because identifying the source of that can prevent a catastrophic stroke.
And so I would imagine that a patient like that would have to have a full workup, maybe going to see a cardiologist, so if it's AFib or if it's a clogged artery or blockage, or what do you do with that patient to prevent a stroke from happening?
Right. So the first thing if somebody's experiencing stroke signs and symptoms, they need to come into the hospital. They need to be seen by neurology first to determine if it was a TIA or not, because a lot of things, potentially could mimic that. And if indeed it is a TIA, there's some basic tests that most patients would go through, looking at the blood vessels of the head and neck to identify any blockages or stenosis in the arteries, looking at the heart to make sure that there's no heart disease and cardiomyopathy, looking at the heart rhythm and function to make sure that there's no arrhythmia. Heart disease can represent up to 25 to 30% of all ischemic strokes where a clot can originate from the heart. So it is a big risk factor. So that may entail seeing a cardiologist as well.
And experiencing a TIA obviously means there is a lack of oxygen or blood somehow getting to the brain, so you need to get to the root cause of that.
Precisely.
We do have a question from Rania. She says, how can I lower my risk for having another stroke? What are the odds of me having another stroke? That's a great question. Okay,
perfect. So we call that secondary prevention. So primary prevention is potentially preventing a stroke from happening in the first place. But if somebody does suffer a stroke, preventing another stroke really is related to what caused it in the first place.
Right.
So we can go back to the heart example. So if somebody has atrial fibrillation, that is a condition where the heart is beating out of rhythm, the top chambers of the heart are not beating in synchrony with the bottom chambers. That can cause turbulent flow, potentially clots in the heart that can go to the brain. So to prevent strokes from that, a patient will be on a blood thinner, and that can reduce the risk of stroke by about 70%. So in those patients who are blood thinners safe in, that would be a way to prevent that. So it really depends on the root cause, and then adjusting the medicines or the treatments that are needed to prevent the next stroke. Yeah.
And that leads into another great question here from Mahmoud, if I hope I'm saying that correctly. And the question is aspirin every day helpful?
So in patients...
Baby aspirin, right?
Yeah.
Baby aspirin?
So in patients who already had a stroke, especially if it's an ischemic stroke where there was a lack of blood to the brain, medicines such as aspirin are required and definitely help prevent future strokes. It's a little different than heart disease, where taking a baby aspirin a day to sort of for your general health, it may not be necessary, and because we don't know the nature of the stroke, if it's a bleeding type or if it's a hemorrhagic stroke and so forth, so it is not generally recommended, by our guidelines.
So it's not necessarily a blood thinner.
Right.
Aspirin.
It is. Well, it is a blood thinner, but I guess routine use of it is not probably been found at least to be beneficial, because there's potential harm to that as well. So I would say talk to your doctor about that to make sure if you're somebody who would need aspirin on a daily basis. Yeah.
Let's talk about some of the treatments, because being a comprehensive stroke center like we are here at Hartford Hospital, it is interesting that the different types of therapies that we offer, and one of the therapies that we do offer is a cooling, sort of using blankets and hypothermia. Talk to us about that and why that's so important and critical.
So that is currently a trial that we're looking into. It has not been shown to be effective in the general population, so we don't usually use that for stroke patients. But there are trials that are looking into using cooling devices to bring down the body temperature, similar to patients who may have suffered cardiac arrest and they have potentially loss of oxygen and blood going to the brain. Those patients get hypothermia, and in that population, dropping the body temperature has been shown to be potentially protective to the brain and may help improve survival, recovery and things like that. So this is a potential trial that we're starting here at Hartford to similarly see the stroke population if they may benefit from it.
Yeah, that's interesting.
Yeah.
Anything else that's on the horizon that for stroke patients that may be beneficial?
Yeah, so I think in the last couple years, there's been a lot of, since then, since 2015, there's been a lot of trials and excitement over these catheter-based procedures. TPA was FDA approved around 1995-96. So, and there was, it was the mainstay of treatment over the past 20 plus years, or 30 years almost now. And then basically what we have now is these catheter-based approaches.
Yeah.
In 2004 or so, when they started coming out, those were the early devices that, and there wasn't a lot of good data to support that. But as of the last couple of years, there's been amazing advancements in that. We have newer devices. We have better technologies to understand how we can use these devices more effectively and what patients would benefit from these procedures. So we're seeing an increase in the amount of treatment rates and potentially benefits from doing these procedures. It also extends our treatment window from the 3 hour up to 6 hours.
Wow,
which is huge. Which is huge.
Yeah.
And we're excited to be part of that. And there's still trials looking into other applications, and potentially in the future there may be more data seeing if we could select other patients outside of that window. But for now, that is the recommendation.
And the stroke survival rate too has gotten better. I mean, there's more that we have more treatments available and clot busting medication we talked about, and opening the stent or putting a stent in to open up a clogged artery. We've seen stories here of incredible, miraculous patients who have come in on the brink of death, but have gotten this type of treatment where you go in and you stent open a clogged artery, and these patients survive, and they're doing incredibly well. They have no deficits. So we've come a long way in stroke care. Absolutely.
And I think that a big part of it is really on us, as a community and on the public. Heart disease, for example, in contrast to stroke, has been there's been a big focus from in the media and the public and everything for many years, and it's much easier to spot somebody who's having a heart attack, and it's painful. Somebody knows there's something wrong. There's CPR. There's tools that you could there's things you could do right away, and the paradigm of treatment has been well established for those patients.
Right.
Stroke is sort of catching on, but there's a lag between the cardiology world and the neurology world and stroke. So what I'm trying to mention is that recognizing stroke and going to the hospital right away is a big part of this, because looking at the data nationwide, although these treatments are available and are very exciting,
people need to come to the hospital
within the time window. Right. So some data suggests that only 10% of patients who suffer a stroke or less are actually eligible for these treatments because they're not coming in on time or don't recognize the stroke symptoms, or had recognized it but second guessed it and things like that.
Or ignoring it. We talked about the TIAs, and it's, well, maybe I might experience a temporary loss of vision or a temporary loss of my speech, but I feel fine, so why bother going to the hospital? So it's important to don't ignore the symptoms and the signs. Let's see. We have another question. How can I lower my risk of having a stroke?
So generally speaking, from a primary prevention standpoint, if I understood the question correctly, know your health, know your risk factors. If you are somebody who has high blood pressure, has sleep apnea, lives a sedentary lifestyle, is a smoker, any recreational drug use, diabetes, these are the types of things that you want to address early on, because in general, we're seeing younger and younger patients having traditional risk factors. Hypertension and heart disease, diabetes, perhaps is not disease of the elderly anymore. We have younger folks in their 40s and so forth experiencing diabetes. There's an obesity epidemic in the country in general. These are things that general risk factors that potentially can cause strokes in the future.
Does stress play a role in stroke?
Yeah, so stress, indirectly can, for sure. If you have a stressful lifestyle, indirectly can cause...
Could affect your blood pressure.
Could affect your blood pressure and, can cause these types of things as well, so yeah.
All right, well, we also want to mention that there is a symposium coming up this Saturday right here at Hartford Hospital called Living with Stroke. And we're really going to go over everything there is to know about stroke, what it is, how to prevent it, some of the services that we offer. It's really going to be soup to nuts, everything you want to know about strokes. And of course, our physician-in-chief of neurology, Dr. Mark Alberts, will be there as well. So that's coming up this Saturday. You do need to register for that class. There's a number on your screen to do so. That's really worthwhile to go there, because that's going to really give you an overall perspective of stroke, right?
We also have, to add to that, we have stroke survivors who speak at the conference. So that's huge. That's huge, because it gives us the insight that we need as providers and as a team, and then also for patients and families to share their experiences and stories. So that is very important. We always value that. We love to hear back from our patients. We love to hear what they go through. We want to know what their families go through, how we can do this better, what do we need to improve the quality of life for our folks.
Sure, and that's another thing, another area that you're going to be focusing on is fatigue and depression. And if you have had a stroke, or if you know somebody who's had a stroke and are experiencing that, it would be great for those patients or family members to come to this, because we're going to be talking about that, and there's going to be stroke survivors there, which can definitely help with that, because that's a big thing after, because if you are suffering from deficits, you have to sort of get used to a whole new lifestyle, and that's difficult for people to deal with.
Precisely, and there's some subtle things that are not recognized. There's the most obvious things are recognized: the motor deficits, the inability to walk without a cane or walk at all, or the arm that's paralyzed, and so forth. But then there's these more subtle things in patients who have minor strokes, and it could be something as simple as post-stroke fatigue or depression, or mild cognitive changes.
Yeah.
And those things are important and need to be recognized.
Absolutely. And I mean, if you have somebody who had a stroke who was very active before and now they can't do the things that they once can, this is important stuff for them to be exposed to.
Absolutely.
Yeah. Well, thank you for sharing.
Oh, thank you for having me.
Great information tonight about stroke. Again, May is Stroke Awareness Month, so know the signs and symptoms. And if you can attend that symposium this Saturday, it's going to be great. It's like I said, it's going to cover everything that you need to know about stroke. Prevention, once you have a stroke, the after effects, rehabilitation, it runs the gamut. So if you can, register for that class, for that symposium is coming up on this Saturday. So that'll do it for this edition of our Facebook Live session. We hope you got something out of this discussion. I sure did. Thank you, Dr. Nouh. And we'll see you right back here very soon. I'm Hartford Healthcare's Tina Verona. Have a great night.